Mr. Chairman and Ranking Member Crapo, and Mr. Secretary, thank you. Yes, you've been here for a good couple of hours now, so thank you for your patience and your service. I want to start with a question about medication-assisted treatment. Healthcare providers in New Hampshire and experts before this committee have made clear that medication-assisted treatment is critical for individuals with opioid use disorders. With medication-assisted treatment, more people can enter and remain in recovery. What is the Department of Health and Human Services doing to expand access to medication-assisted treatment?
Well, we've been working with our partners in the Department of Drug Enforcement and the Department of Justice to make sure that we can move forward because we've seen the data proves it.
Right.
The science and the evidence show that medication-assisted treatment works. And so we want to make sure that we give providers the flexibility to offer that treatment to a lot of folks who will benefit from it. So we're going to be driven by the science and the evidence, working with you, and thank you for all the work you've done on this to make it possible for folks to recover.
Well, that is good to hear. There were obviously restrictions lifted and some flexibilities granted during the pandemic, and it sounds like you're going to continue to work with the DEA and states to make sure that we could perhaps make some of those permanent, again, based on data.
Absolutely.
Thank you. As drug prices soar, Granite Staters are rationing life-saving medications because they can't afford them, choosing between filling their prescriptions and putting food on the table. One of my constituents stopped taking her blood pressure medication for periods of time and suffered a stroke and is now in long-term care, something she was hoping to avoid as she aged. Congress has to take immediate action to cut drug prices. How would allowing Medicare to negotiate drug prices save money for patients and reduce federal spending?
Well, Senator, as you just pointed out with one of your constituents, not taking medication as needed, that's so common. 1 in 3 Americans have reported to us that they don't take the medication they're supposed to because they can't afford to continue to use it up as quickly as they would. And so we have to do something. We are ready to use whatever authorities we have. We don't believe we have the kind of authorities that won't send us to court to be able to do as good a job as you all could do to change some of the law, to give us more authorities. But if we were able to, for example, negotiate the price of drugs, the way you negotiate the price of a car, the way you negotiate the price of that mechanic bill, there's no reason why when something as important and precious as a medical service or a prescription drug, you can't get the best price for your patient or your loved one. Give us that opportunity through Medicare, and we will lower the price of prescription drug medication for Americans.
Well, I hope we can find bipartisan support to do just that. Thank you for your commitment to lowering the cost for prescription drugs. I want to move on to the issue of Title X. State laws restricting women's capacity to make their own health care decisions and, frankly, chart their own destiny are forcing some family planning centers to close and others to serve entire regions using very limited resources. New Hampshire state government recent decisions to reject federally funded contracts to some family planning centers is going to make it harder for centers to serve their patients. How have state anti-choice restrictions influenced the budget request for family planning funds?
Senator, first and foremost, we must enforce and comply with federal law. And under federal law, family planning services should be available to families who qualify. We're going to make sure that we provide that service, including contraception services, to families throughout the country. We respect what states wish to do in terms of how they implement their particular laws and their enforcement and administration of their services, but we have an obligation to make sure that under our laws, our federal laws, no one is discriminated. And so we're going to make family planning services available to everyone who qualifies under federal law.
Well, I thank you for that commitment. That's why I'm working to increase Title X funding in the fiscal year 2023 appropriations bill. I look forward to working with you to make sure that that happens so that we can support these critical services for women in New Hampshire and all across the country. A quick question about childcare and Head Start. The Office of Head Start and the Office of Child Care operate two very different but equally important programs to support early learning. Combined, these two offices help more than 2 million children access affordable childcare across the country each year. How will HHS most effectively use the current proposed budget increase to ensure that these two agencies work collaboratively to serve as many families as possible?
Senator, one thing I can tell you is that we wish to have those services be as seamless as possible. So whether it's early Head Start program, or whether it's just childcare for the infant toddler, we want to make sure that throughout that process, a family knows that their child will get the best care and educational services possible. So we're going to try to be as coordinated as we can to make that as seamless a process as possible.
Well, I appreciate that very much. Thank you, Mr. Chair.